Hi, welcome to our webinar tonight. We are talking more in our series of anti-aging and what you can do to live your longest life with vitality, longevity, happiness, and peace. Well, over the years, many people have asked me, Doctor, is there anything I can do? I'm so very worried because in my family there's kidney cancer or pancreas cancer, brain cancer, ovarian, or the like. And to be frank, I did not have a very good answer to give them. Because up until now, there were only 5 cancers that we had screening tools for. And those 5 cancers, which I'll mention in a moment, only accounted for 29% of the deaths. So what that means is that 71% of all the people, young and old, that die of cancer, they die because we didn't find those cancers until they were in very, very late stages. As a matter of fact, they were found in stage 3 or 4 cancer with metastases, meaning that it was spread to different areas of the body, which makes it so very much harder to cure and or treat. So as most of you know, I'm Dr. Kelly Birkenstock, owner of Skin Body Health in New Orleans, Louisiana, and Mandeville, Louisiana. We're also licensed in Alabama and Florida. We serve many people nationwide by teleconference via Zoom or other, and it would be our pleasure to serve you. We have a big anti-aging practice. We treat with bioidentical natural hormones, andropause and menopause. We do hair replacement, DNA weight loss, skin DNA to prevent your skin from aging, to give you the exact recipe for your skin. And now the breakthrough we want to discuss tonight is there's a new cancer tool, a tool that can help us find 50 of the cancers that were killing 71% of the population that got cancer. Why? Because before this blood test, there wasn't one before. Before this blood test, we only caught cancers when they were very symptomatic, when people began to have pain or severe weight loss or some other vision changes, bleeding. And it was a very, very sad thing to find them at such a stage that we didn't have much to help. So this new innovation in early cancer detection is via just a regular blood test, as if you were drawing blood for one of your regular or annual visits. This breakthrough technology is quoted in the Cleveland Clinic's current literature as a game-changing technique to catch more than 50 kinds of cancers in one simple test. We began researching and hearing about this in one of our medical publications, the Annuals of Oncology, in the June 2021 issue, when they began to make mention of in articles that they were detecting cancer signals in a single blood draw using a multi-cancer early detection test. So I began following the research and aligned with the company, and we are now able to offer it in both of our locations, and we can mail it to some of our clients that are located in other areas. As you may know, we do our webinars every week or every other week, and we've been doing them for years. If you've missed any of our previous webinars on anti-aging, Botox, hormones, etc., you can find it on our YouTube channel, Dr. Birkenstock's Skin Body Health. If you're watching from TikTok or Instagram, like and share us to be entered in our weekly drawing. This week we're going to be giving out PJ's coffee gift cards, ranging anywhere from $10 to $25. So be one of the first to like and share, especially hit that share button on TikTok, Instagram, and Facebook. We'd love to hear from you, and we're happy to share our PJ coffee cards with you. So today we're talking about this new innovation, and it has become so important because by the year 2030, we always hear about, in the past and currently, heart disease being the major killer in the United States of America, and that it's the top threat in the United States, and how we should eat better and exercise to avoid this threat of heart problems and death. But by the year 2030, which is not that very far away, we're talking about 7 short years, cancer will be the leading killer of people across the United States and America. We're seeing it in younger people, and we're seeing it at later stages. So by offering this blood test, we can find it earlier. So many people who have a lot of cancers in their family history, or perhaps they've had a small cancer in their personal history before, or those that are just worried sick about the ugly word cancer, we now have this test, this simple blood test that we can draw, and within 2 to 3 weeks tops, we can have a full profile of your blood showing if there are any cancer signals in your blood, and if so, where they're coming from. So maybe they're coming from the esophagus or the pancreas or the colon, ovarian, or the like. But we know this because it also tells us the origin or the area of the body that the signal, cancer signal, is coming from. Of course, we oftentimes and most times get to deliver the beautiful report that nope, there's no current cancer cells in the body. There is no perfect 100% test. Of the 5 screening tools that we've had for years, mammography for breast cancer, Pap smears and HPV testing for cervical cancer, colonoscopies and Cologuard for colon cancer, X-ray and CAT scans for lung cancer, PSA in the blood for prostate cancer. Those are only 5. And again, this test tests for over 50. What we now know too is that we're beginning to please ask our clients to begin their colonoscopies at age 45 when we used to recommend them at age 50, because at age 50 and beyond used to be the highest rate of colon cancer. What we're now finding out is that we have to lower that to age 45 because there are younger and younger people presenting with colon cancer in males and females. Is some of this related to diet? You betcha. So all the processed foods, all the foods from the fast foods establishment that are full with xenoestrogens, which are bad forms of synthetic estrogens, PBA, PHA, and other BPA, BPH found in a lot of our plastic products. They leach. They leach in microwaves. They leach into our foods when we use them as storage bags or storage containers. And first they said, oh, only BPA was bad. So then you began to see on the shelves in the grocery, BPA free, BPA free. Well, that's only because they hadn't tested the other BPs yet, like BPH, BPF. Suffice it to say, plastic is not your friend. There are xenoestrogens in our pollution and smog as well, in the cigarettes that we smoke, and the foods we eat from the fast food establishments, and the like. So eat well, eat fresh, eat all your fresh foods and fruits and vegetables. Broccoli is just jam-packed with cancer-fighting antioxidants. All of your vegetables help in this arena. Remember, colored foods are your best. Your orange foods like your bell peppers and your oranges. Your green foods like your bell peppers and your cucumbers. And big Mr. Broccoli, kale. Your red foods like your apples and radishes. Your purple foods like your eggplants and your blueberries. Color is your best friend. White foods are over-processed foods, and those are usually found in boxes and or cans. And that's bread, rice, pasta, potatoes, and white sugar. They're all bad for you. Sorry to let you know about that. So stick with your colored foods. Stick with your fresh foods. This time of year, enjoy your pumpkins. Enjoy your red pomegranates. They're so good for you. And if you're worried about cancer, or cancer runs in your history, with a single blood test, you can find out whether or not you currently have cancer signals circulating in your body. No test, as we said, is 100%. Even mammograms, Pap smears, prostate exams, PSA, and colonoscopies. None of them are 100%. This test, that tests for over 50 cancers of the 71% of the top cancers that kill us, they detected over 90% of the time. That's 90, over 90% of the time. While it's currently not covered by insurance, neither are some of the other DNA testing tools. The DNA testing tools like BRCA1, etc., in a case where you would like to know if you've got that genetic gene, in many, many cases, not all, but in many cases aren't covered by insurance either. The DNA tools like BRCA1, those tools tell you if you have a risk of cancer. A risk sometime in the future that you might have the genetic DNA that would lean you towards having a breast cancer or ovarian cancer with the CA125, etc. This test tells you if you currently have cancer cells in your blood. We'd love to offer it to you if we can help in any way. Please spread the news. While the test may not be applicable for you at your current time in life, it may be applicable to someone that you know and love, family or friend. It's a great breakthrough. If we can help anybody, please call our office, 985-727-7676. That's 985-727-7676. You can text us to that line as well. Our website, skinbodyhealth.com. That's skinbodyhealth.com. YouTube channel, Dr. Birkenstock Skin Body Health. And if you'd like to email us, our email is info, I-N-F-O, at skinbodyhealth.com. I'm going to repeat that phone number for you one more time. 985-727-7676. The new cancer screening, backed by Cleveland Clinics Institute, got the been through lots of research and studies, printed in the Annals of Oncology in 2021. We're happy to offer it to you and bring the information to you. Give us a call if we can help you or your loved ones. As always, it's been my pleasure speaking with you. I'm Dr. Kelly Birkenstock. Good evening.